The Evidence2Practice Ontario program is supporting the delivery of care across the province by making it easier for clinicians to access and apply best practice information and quality standards at the point of care. E2P is co-led by the Centre for Effective Practice, eHealth Centre of Excellence, and North York General Hospital, and funded by Ontario Health. Disclaimer: our goal is to support clinicians with care decisions while also optimizing clinical workflows. Please consider these supports a supplement to clinical care rather than a replacement. We deeply value the work clinicians do each and every day to provide high-quality patient care. Welcome to the Evidence2Practice Anxiety Disorders and Depression Tool, your comprehensive companion for mental health screening and management within TELUS PSS EMR. Join us as we navigate through its features and functionalities. The tool is designed to support evidence-based decision-making by presenting key clinical information, guiding assessments, and recommending appropriate interventions. By integrating patient-specific data, standardized mental health metrics, and relevant clinical guidelines, the tool aims to improve diagnostic accuracy and treatment planning, facilitate real-time monitoring of patient progress and outcomes, ensure consistency in clinical decision-making across care teams, promote personalized, patient-centered care by identifying potential risks, barriers, and treatment options, and enhance collaboration and communication among healthcare providers involved in the patient's care. Here, we will demonstrate E2P tools based on two different scenarios. Patient scenario number 1. Patient 1 is newly diagnosed and the tool has not been used with this patient previously. For a patient with new or recent mental health struggles or concerns, clicking on the Anxiety and Depression button will initiate the screening and diagnosis section of the tool to open. In this workflow, users can review patient scores and complete the appropriate screening tools for major depression, along with various anxiety disorders, including generalized anxiety disorder, social anxiety disorder, panic disorder, and agoraphobia. Based on the results, users can record whether a diagnosis is suspected or confirmed. To support screening and diagnosis, the tool also includes the relevant lab investigations summary for the users to review. After the screening and diagnosis portion has been completed, users can navigate to the full visit tool. For an initial or first mental health visit with the patient, users may want to document the patient's history. To do this, select Dashboard, and the patient's metrics, labs, and history will open. Here, users can discuss and record key components of the patient's history of stress or trauma, any non-pharmacological history and response, medication history and response, as well as family history. All the information added to this section will be saved for future review and revision, meaning the next time the form is opened, the information will remain and will not have to be entered again. Thorough and sensitive documentation of a patient's mental health history is essential for providing effective care. By covering stress or trauma history, medication history, family history, and non-pharmacological treatments, you ensure a holistic view of the patient's mental health that will guide treatment and support. After the screening and diagnosis portion has been completed, users can navigate to the full visit tool. The comprehensive assessment section may also be completed during an initial visit, as it is key to understanding a patient's emotional, psychological, and social well-being. As part of the assessment process, it's essential to gather detailed information, including any recent life stressors or past trauma, social determinants of health, current lifestyle, personal and psychosocial support, the patient's mental status, as well as any pertinent comorbid mental or physical health conditions. During this time, users may want to conduct a suicide risk assessment and document whether a safety plan was discussed or complete a Form 1 application. Patient scenario number 2. Our second patient is a patient who has been diagnosed for a number of years. Mental health is dynamic and diagnoses can evolve as more information becomes available. This form is designed to keep pace with that evolution, allowing users to easily update and refine a patient's diagnosis as needed. For example, if you initially suspected generalized anxiety disorder, but later determined that the patient also meets criteria for social anxiety disorder, the diagnosis status workflow enables you to document these changes smoothly. This flexibility ensures that the patient's record stays accurate and up to date throughout their treatment journey. This flowsheet is designed to be both comprehensive and adaptable. While it covers all key areas of a patient's mental health, it allows users the flexibility to focus on the sections that are most relevant at the moment. We understand that some information may become clearer as you gather more details over time, so feel free to revisit and update other sections as needed. This approach ensures that users can document what's most important now while leaving room for further input down the line. Users have the flexibility to either view the full visit tool with all the components or select specific sections to focus on during the patient visit. Let's delve into the main sections of the tool. The comprehensive assessment allows clinicians to develop a complete picture of the patient's history, current challenges, and mental status. The Management Plan section enables users to document and connect the patient to psychotherapy interventions and discuss lifestyle changes, including first-line and second-line therapy options. In the Medications module, clinicians can use the medication reference table to review the best practice medications as well as document medication adherence and response. The medication section encourages users to engage the patient in shared decision-making about their medications. The tool embeds resources for the clinician to review information on adjusting medications, switching monotherapy, and adding adjunctive medications, and so much more. Lastly, the referrals and follow-up section include guidance on the recommended follow-up schedule with the patient, as well as the ability to document any referral or follow-up notes. Included in this section is the link to the Resources and Patient Care Plan, which is a consolidated form that houses a library of resources and tools for all the conditions in the E2P tool repository. The goal is to support shared decision-making, patient education, and the creation of comprehensive care plans that can be printed for the patient to take with them. At the end of the visit, users will click on the Generate Summary Note, Complete Form button to close the form. By doing this, whether a few sections or all of them were completed, the tool will generate a summary note, pulling in all the information documented in the tool and copying it into the patient's notes section of the EMR for users to review. Users will also always be able to review the original form by clicking on the Click to Expand button, which will trigger the whole tool to be visible. User and installation guides are available for download on the community portal. If you do not have an account, please visit this website. The change management team will be happy to support you if you require assistance with installation. Please reach out to Evidence2Practice at cep.health. Dedicated to supporting primary care clinicians, allied health professionals, and clinic staff, the eHealth Center of Excellence offer guided tool installations and technical setup and guidance on how to optimize the integration of the tools into your existing workflow. In addition, our partners at the Center for Effective Practice can offer supplementary one-on-one discussions with an academic detailer on balanced, evidence-based information on insulin therapy for type 2 diabetes and non-insulin therapy for type 2 diabetes. With E2P, clinicians can provide enhanced care for their patients, all while reducing their own workload and stress. Try our anxiety disorders and depression tool today, and remember, our team is here to help. Learn more or sign up at e2p.ca today.